TMS stands for transcranial magnetic stimulation. It is a non-invasive form of brain stimulation, meaning it belongs to a set of technologies which can modulate the excitability of the brain without requiring an invasive procedure like surgery. TMS uses electromagnetic induction to generate an electrical current across the scalp. It is safe and effective and produces minimal side effects. In short, TMS involves applying a series of brief magnetic pulses to stimulate neurons in brain regions of interest. These regions of interest are typically areas of the brain in which abnormal functioning has been associated with various psychopathologies. Magnetic pulses are generated in a plastic enclosed coil of wire, which can pass easily through the skull into the brain. The coil is placed on the skull over the brain region of interest, and the magnetic field can then be targeted to excite or inhibit brain activity, depending on the brain region, charge of the target cells, cell environment, as well as certain parameters of the stimulation. TMS can have varying effects on the brain depending on the frequency, pattern, amplitude, and duration of stimulation, as well as the orientation of the coil. These various parameters can be useful when normalizing activity in the brain because sometimes the brain can be over or underactive in certain regions. Repetitive TMS, or rTMS, yields effects that are longer lasting and can endure beyond the period of stimulation and thus is used for treatment.
When using the coil for treatment, electricity flows through the coil, which generates a magnetic field. When you stimulate a certain brain region, the magnetic field will generate a pulse perpendicular to the tangential point of the coils. This pulse will depolarize the neurons, which allows them to fire an action potential. The coil stimulation intensity and pulse frequency can be adjusted depending on the prescribed treatment. Now that you know how TMS works, let's see it in action. I'm going to use a TMS coil to send a pulse and stimulate a specific cortical area in Louise's brain. Here I'll be stimulating Louise's primary motor cortex at the hand knob to see if I can elicit a contraction in one of her hand muscles contralateral to the side of stimulation. I'll first have to stimulate in the area around the region before I find the correct spot where stimulation elicits a consistent response in the hand muscle. When stimulating the motor cortex, we can use the patient's brain MRI to guide our coil to the right spot. We can then determine the best area of the motor cortex by looking at the activity generated by her hand muscle in the monitor here. We see that when I stimulate at this spot on her motor cortex, we get a consistent response in her hand. You can change the intensity of the stimulation to generate a stronger response. You'll see why this is important in the next section.
TMS can be used to treat multiple disorders that involve imbalances in brain activity. For example, many patients suffering from depression will turn to TMS when other treatments like cognitive behavioral therapy and medications have failed. TMS can also treat other disorders, including obsessive compulsive disorder, pain associated with migraines, and smoking addiction. In a research setting, TMS is used to study brain physiology. By using TMS, or rTMS, to change brain activity, we can learn about brain area function and connectivity. One limitation is that for the most part, TMS can only stimulate neocortical brain regions 2 centimeters deep. This is limiting because depression and other psychiatric illnesses can be caused by dysregulation of activity in deeper brain regions like the amygdala. The effect of TMS also depends on what the brain is doing when it is applied. Stimulating the brain at rest is not the same as stimulating the brain working on a specific cognitive task. Despite the limitations, there are many advantages to TMS. There are very few side effects, and in general, TMS is well tolerated. It can be effective in treating disorders such as depression in up to 75% of patients, and without the kind of side effects that come with other standard treatments like psychoactive medication. It also does not take long to elicit its effects. It can provide relief within a week, while other treatments take much longer.
TMS allows researchers to make causal inferences about brain function, unlike most neuroimaging techniques, which are just observational or correlational. Using TMS, you can briefly disrupt brain activity in a very specific region, and then you can look at how that changes behavior. For example, applying TMS to a visual object processing area makes people less accurate on object processing tasks, but not on face processing tasks. Applying TMS to an adjacent face processing area will cause the opposite effects. You can also use it to test the time course of processing in a brain region. By presenting TMS at different points in time on different trials, you can ask when the effects of TMS are most influential on behavior, and that can tell you when that information was being processed by that area. TMS can also be used in conjunction with fMRI or EEG. For example, applying TMS to a certain region and then looking at how the neural activity changes as a result.